Welcome to this video on the examination process. It is a systematic, patient-centered approach to clinical reasoning. Keep in mind one big idea. Every part of the exam should answer a clinical question and prioritize patient safety.
By the end of this video, you will be able to organize the examination components and explain their relevance. Strong communication and good documentation are critical for reducing errors and ensuring continuity of care.
The examination workflow begins with preparation and communication, followed by history, observation, and physical assessment. The last steps are formulating a clinical impression, considering referral and documentation. Professionalism requires respecting dignity, privacy, and practicing within your scope. Culturally responsive care means asking before assuming, respecting values, and avoiding labeling patients by diagnosis. High-value communication behaviors include listening without interrupting, reflecting, and summarizing what you heard. Avoid common barriers like medical jargon or giving advice before identifying the chief complaint.
The examination process figure provides an integrated framework. Notice how the steps flow logically and emphasize patient safety, individualizing care, and continuous reassessment. SBAR is used for clear communication with other providers.
History taking is the subjective exam. Start with core open-ended questions like what happened, and structure follow-up questions using OPQRSTI to gather details about onset, provocation, quality, severity, and timing. The objective exam involves observation, palpation, range of motion, strength testing, neurovascular screen, and special tests. Each component helps answer a specific clinical question, guiding your next step in the clinical reasoning process. SBAR is a standardized tool for communication. Clearly state the situation and provide background details. The assessment is your clinical impression and key findings. Finally, the recommendation states what you need to happen next. Documentation is essential for communication, continuity of care, legal protection, and quality assurance. Best practice habits include using objective, precise language and documenting promptly while maintaining confidentiality. Consider this clinical scenario. A soccer athlete has anterior knee pain worsening with stairs, squatting, and after practice with no trauma. How would you apply the examination framework? Which questions and objective tests are most relevant? Key takeaways. Always start with the patient, using respect and communication before testing. Use a framework for efficiency, and ensure clinical reasoning is complete through clear documentation and communication. Collect meaningful data, explain what it means, and match the plan to the patient. These selected references offer deeper insights into professional standards and the structure of clinical examination. Continue to connect history, anatomy, findings, and documentation into one complete clinical reasoning process for optimal patient care.